Okay, so final lesson. Let's go over how to start an IV. IVs are very common, and it's awesome if you can get good at these and be confident. Your patient will have all the more confidence in you if you are confident. So lots of patients hate this, and it's best if you can just be efficient and get it over with. So first thing you want to do is get your order. Of course, make sure you have an order for this. And then you're going to you're going to gather all your supplies. Make sure you have that before you even go into the patient's room. Then you don't have to leave. Sometimes it's already in the patient's room ready to go, and that's fine, like if you're in the ED or something. So get your kit. Your kit should have, and you should have a 20 gauge needle. Can vary. So if you're doing blood products, it's going to be a higher gauge, a smaller number, bigger gauge needle. So got an 18 for blood products. You do 20 to 22 for like saline or IV drug administration, something like that. So you want to find out what you're putting the IV in for before you start so that you can select the appropriate gauge needle. This is, we're going to say for an IV saline, and we're going to go with the 20. And you want to make sure you have tubing, normal saline syringe. You'll have a little 10 to 30 ml syringe that you can flush your lines with. And then make sure you have your tourniquet. So what you want to do is come in, verify name, date of birth, any allergies with your patient, discuss with them why we're getting an IV, and then maintain some autonomy. So let them make some choices if they can. Ask them, which hand is their dominant hand, and try to keep that one free of the IVs just for convenience. You may also ask them which veins are good. So if this isn't their first time getting an IV, they might know exactly which veins to use, or they may tell you, this hand doesn't work, or whatever. So listen to your patient. They can be very informative. Find out what they prefer. Then you are going to get your tourniquet ready. Have the patient drop their hand. We want to get that blood flowing into those veins, and then hopefully they'll fill up really well, and then you'll be able to pick a vein. So put your tourniquet on, depending on where you want to start your IV. Some people go into the forearm, some people want to go into the AC, so that will determine where your tourniquet goes. You want it above the site or proximal to the site. So let's attach your tourniquet. You want it pretty tight. You want to be able to release it really easily. So practicing that is helpful to get that tourniquet on efficiently. So you've got your tourniquet on. Patient has their hand down. They're going to be pumping their fist a little bit, helping to get that blood flowing. And then you can identify which vein you want to use. Go ahead and release that tourniquet once you've identified your vein, and then you can prep your supplies. So you don't want to just leave that tourniquet on. You don't want to blow the vein before you even start. So go ahead and prep those supplies. You are going to open up your needle. You're going to open up your saline flush, attach it to the tubing. Actually, before you even attach it to the tubing, you want to prime that. So go ahead and push out a little bit of fluid from that syringe. Just make sure you've primed that, and then you're going to go ahead and attach it to your tubing and prime that line as well. So you'll push all the air out. You may get some saline solution leaking out of it, and that's good. You want to make sure you've cleaned it all the way out. Then you want to clean the surface of the skin. So before we get going with that, we want to retie the tourniquet. So you know which vein you're going for. Your needle is ready. Your saline is ready. Your tubing is ready. So get your cleaning supplies ready, and then go ahead and tie that tourniquet back on. So we're going to identify our vein again. We're going to clean the area really well. So let's say we're going for a hand vein. If I'm going for this little guy here, then I'm going to clean this whole hand. Just make sure it's nice and clean. We don't want to introduce any pathogens or bacteria into the bloodstream. So make sure it's a good 15 to 30 seconds worth. You're going to do a cross-hex pattern or a circular with whatever your hospital or your facility mandates. So maybe it's chlorhexidine, maybe it's betadine. Just clean it really well. Maybe, who knows what they're going to give you. So make sure that air dries. You don't want to blow it dry. You don't want to wipe it off. Just let it air dry. Once it's air dried, you can get your needle ready. Go ahead and pop the top off, and you're going to make sure, check your needle, that the bevel is up before you get started. So you can go ahead and check your angle. You should be at about a 15 to 20 degree angle. The size of your patient may also influence that. If you have a really heavy patient, that vein may be a little bit deeper. So go ahead and just assess which angle. Then you're going to go ahead and insert the needle into the vein. So as soon as you start to see some blood fill that collection chamber, you can insert it just a tiny bit more, and then you want to, without touching the catheter, advance the small plastic top of that. So you're going to push the catheter all the way in until it reaches the skin. Once you've got your catheter all the way in, you can occlude the veins. So you will have one hand on the needle, use your other to occlude the vein, and then you can start to pull that needle out. At Renown, the needles that I've used, if you don't pull it out all the way, then it will help to stop any blood from leaking out. So you can occlude, and then you can also have that without pulling it all the way. And then I like to put a little piece of cotton, a cotton square underneath of that catheter just to catch anything. So you're covered there. Then you want to grab your tubing and you want to attach it to that catheter. You may have needed to get blood samples first. So depending on what your doctor is ordering this IV for, you may have attachments there for blood samples, and then you would grab that first. So attach your blood sample tubing, let it fill those tubes as ordered, and then once those are done, you can go ahead and grab your tubing with the saline. Attach that tubing, then you want to inject the saline and make sure that that vein is patent. So listen for the patient to tell you that anything is burning, look for any bubbling or swelling, and then just make sure that that line is good. So once we're happy with our line and our IV, then we can go ahead and secure it. So you'll go ahead and put a Tegaderm on. You should have pulled out your cotton, date and time the Tegaderm. Make sure there's no air underneath of it. You want a good seal, make sure it's fully attached. And then you can go ahead and wrap that tubing up the arm until you're ready to use your IV for whatever you needed it for. If you're going to attach a bag of saline, or if you're going to attach IV drugs or do a push or whatever. So that is it. Make sure you've released your tourniquet. Don't leave that on. Probably best to take that off before you even secure once you get your Tegaderm on, you can just pull that tourniquet off, and then you are done.